After your knee replacement, are you wondering how long it will take for your pain to go away? Or if you're going to have a knee replacement, are you thinking of when will I recover? This is a question that I will answer for you in this video. So stay tuned. Hi, my name is Reggie from Result Plus Physical Therapy. And in this video, I want to explain to you how long it takes for you to recover from that knee replacement. This is a question that a lot of people would ask, because one is, if they're asking this before their knee replacement, it's because they want to plan things in advance. So let's say, for example, they have a vacation that they're planning for next year. That's something I see a lot in the clinic. Oh, I want to go on a cruise, or I want to go hiking in April. So when do I do my surgery? Or if they have something that they know personal situation wise, one example will be I will be by myself on this day, on this month, so that way I know I have to prepare for that. Or they have to ask their family or friends to take care of them or help them out at the beginning, so they want to be able to tell the person how long they will need them for. So these are the questions that a lot of times the patients will ask before they go into that knee replacement. Or sometimes, if you already had your knee replacement, then you're thinking, especially if you're in for a rough start there, some people have to go through some pain in terms of the recovery. People are thinking, when is this gonna end? When is this pain gonna get better? When is my knee going to move? So in this video, I want to at least tell you more or less what the answer is, all right? And the answer there is, usually it takes 6 months to a year. That's what your surgeon is going to tell you. That's what your therapist is going to tell you. That's what most medical professionals who have experience, that's what we're going to tell you. 6 months to a year can be a long time, yes. But because you have to understand that they replace your whole joint. All right, they cut off the bones from bone and then use prostheses, metal, to actually replace that. You have a lot of tissue trauma there. You have a lot of inflammation going on, a lot of swelling. So that, your body will have to resolve those, and it takes time. So 6 months to a year is what we usually say. Now, when the patients have therapy, I usually tell them around 3 months they'll be functional, because insurances nowadays, or even patients, they won't go for a whole year of therapy. Most of the time our patients, 3 months, if everything works well, everything's done correctly, they will be functional, meaning they'll be able to go, they'll be able to walk around the community, they'll be able to go up and down the subway stairs, they'll be able to actually go dancing, enjoy, some maybe even go hiking. So they'll be able to do things that they love to do, usually around 6 months. But I tell patients usually 3 to 6 months, because it depends on certain medical conditions and depends on your health. If you have diabetes, it takes you longer. My rule of thumb there is, usually if my patients have diabetes, whatever I estimate that I see usually in their condition, I would double that. Because when you have diabetes, you heal slower, right? They have other medical conditions involved. So that I tell them 3 to 6 months in the clinic, but overall it's going to be 6 months to a year. All right, so that's a situation. So that's a length of time it takes, because your body has to resolve all those, all those inflammation, all those swelling, and it has to get used to the prostheses that you have there. Now, why is it a big range there? Aside from those medical conditions that I mentioned, there are some people who heal slower. If they're healthier, chances are they heal faster. If they're not as healthy, their diet is poor, they don't heal as well. So they will take longer time to heal. The other one is, some people are scar formers. Some people are even keloid formers. Those scars will affect your movement. So the scars will make your the scar tissue will make your joint more limited. It may interfere with your bending. Most of the time, the bending is the one that's involved. But if the scar are inside the joint, that it may affect your extension also. So some people form more scars, and that limits their bending, their range of motion, even the extension, and that will affect their walking, and that will affect all the other functions, especially going up and down steps, and also sitting in low seats, or bending down, picking things up on the floor. If your knee doesn't bend, you won't be able to do those activities, or you're going to have a hard time doing those activities. Okay, so that's the reason why we give a big range, because everybody is different there. So I hope you understand that now, but at least now also you know you can assess based on your personal condition, your medical condition, based on your health, which one you probably will be. But there's no definite way of telling, because you can be healthy and you form a lot of scars. It will take you longer also. But I hope I shed some light there. You have an idea of more or less how long it will take for you to recover, so you can plan accordingly for whatever things that you need to arrange. All right, so let me know what you think. Is this helpful for you? I would love to know your thoughts. And if you find this helpful, please share this with friends, with family, with people you love, especially if they're undergoing surgery or they're undergoing a knee replacement. So that way they would understand how long they will need, how long they will need support, how long before they can actually plan certain things like vacations. Okay, so thank you very much for your time, for watching this video. I really appreciate, because you can be doing anything else. So I appreciate your time, and definitely hit that subscribe button, turn on your notification, so that way you can get alerted on the future videos that we create. We create one every week, just to share knowledge and tips on how to be healthy and how to be pain-free. All right, I'll see you in the next video. Bye.